back to the Medigap Show, your trusted source for all things Medicare. I'm Holly Cohen, licensed agent and founder of medigapcares.org. In this comprehensive video, we're going to explore the differences and similarities between Medigap Plan G and Medigap Plan N. By the end of this video, you'll have a clear understanding of these plans and be better equipped to make an informed decision for yourself. But first, please make sure to subscribe if you haven't already and visit medigapcares.org to schedule a free Medicare appointment with either me or an experienced member of my team. So let's dive in. Plan G and Plan N both provide valuable coverage that supplements original Medicare. They both cover the 20% gap after original Medicare pays the first 80% of anything that your doctor orders for you and deems as medically necessary, ensuring that you have comprehensive coverage for your health care. However, there are differences between these two plans. While Plan G and Plan N share many similarities, there are some differences that are worth noting. For example, Plan G covers the Part B excess charges, which are additional fees that a doctor may charge above and beyond the Medicare approved amounts. This means that with Plan G, you don't ever have to worry about these Part B excess charges, as the plan does provide coverage for them. However, with Plan N, you would be responsible for paying these Part B charges, excess charges, out of pocket if the provider does not want to accept what Medicare was paying them. You're responsible for up to 15% above the Medicare approved amount on a Plan N if that provider does not accept what Medicare will pay them for their services. So let's talk about premiums and cost sharing. Plan G generally has a higher monthly premium compared to Plan N. Plan N introduces cost sharing in the form of up to $20 co-payments for doctor visits and up to a $50 co-payment for emergency room visits. With the co-pay for doctor's visits, typically up to $20, it's important to carefully evaluate your healthcare needs and budget when choosing between these two plans. How often do you go to the doctor? Does it make sense that every time you go to the doctor, the $20 that you will have to spend at the doctor will not exceed the difference between the monthly premium cost of Plan G versus the monthly premium cost of Plan N? Some states are called Medicare overage measure states, or we also call them MOM states. These states include New York, Pennsylvania, Ohio, Minnesota, Massachusetts, Connecticut, Rhode Island, and Vermont. These states have implemented rules and laws to protect consumers from Part B excess costs by making it illegal for any doctor or outpatient provider in those states to charge above what Medicare has pre-approved for the amounts. If you reside in one of these states, both Plan G or Plan N can provide you with valuable coverage, the exact same coverage almost, except for the up to $20 copay is still charged in those MOM states. Also, if you happen to travel outside of a MOM state, that means that you would also be responsible for Part B excess charges, possibly, if you're outside of one of the MOM states. Only 5% of doctors across the country actually charge above and beyond what Medicare pays them for the services, which is what's called Medicare approved amounts, also called Medicare assignment. The way you can avoid that Medicare overage if you do not live in a state that has imposed the MOM law, number one, verify your providers through Medicare.gov. If you log in, you can see exactly, you pull up your provider list and you can search that database on Medicare.gov to see if your provider accepts what Medicare is paying them, which is what's called Medicare assignment. Remember, if you are having surgery, there may be multiple providers involved. So be sure to know who everyone is on your team so that you can look them all up individually to see if they all accept Medicare approved amounts, also called Medicare assignment, if you're on a Plan N and you live outside of one of the mom states. Number 2, you can also call your provider directly and ask them if they accept Medicare approved amounts or Medicare assignment, same thing, when you are scheduling your appointment. What I always tell everyone is a Part B service is typically a scheduled service. So it's a planned service. And so you're not going to be hit with too big of a bill because you'll be prepared for it. It's not like when you have to go to the hospital, that's covered under Part A. These are simply Part B excess charges. So if you're on Plan N or evaluating it, you need to really consider how often you go to the doctor. Now let's consider a real life scenario where someone utilizes Plan N. Meet Sarah, Medicare beneficiary who recently enrolled in Plan N. Sarah goes to a specialist for a procedure, and unfortunately, the Part B provider she visits does not accept Medicare approved amounts. As a result, Sarah incurs Part B excess charges because she lives outside of a mom state and she's on Plan N. So she is responsible for paying these excess charges up to 15% above and beyond the approved amount that is not covered by Plan N. So this highlights the importance and understanding of Part B excess charges and considering them when choosing a Medigap plan. To summarize, both Medigap Plan G and Medigap Plan N provide valuable coverage that supplement original Medicare, meaning there are no networks, you can go anywhere in the country that you want to go. It doesn't matter what name of an insurance company is on your letter G or your letter N card. It could say McDonald's or even Dunkin' Donuts, seriously, because your provider, when you're on a Medigap Plan G or a Medigap Plan N, is never going to bill your insurer. They're going to bill Medicare. They're going to bill to our National Medicare Fund, and our federal government has an outside contracting billing company an outside billing contractor that pays back your provider 80% of the amount that is billed, and then Medicare bills the 20% to your Medigap Plan G or your Medigap Plan N insurance carrier. So that's why I always joke and say it doesn't matter what name is on your Plan G or your Plan N card because there are no networks. It's a direct bill system. Your doctors and your hospitals are directly billing to Medicare. The only important thing, once you determine that you do want to be on Medigap rather than the other program, Medicare Advantage, which I cover in multiple videos, the good, the bad, and the ugly of those plans, Medigap Plan G or a Medigap Plan N keeps you on original Medicare, meaning anything your doctor orders for you and deems as medically necessary must be covered at 80% by Medicare. Medicare is driving the bus, and that Plan G or that Plan N is then riding the bus.